Tuberculosis is preventable. TB can be cured. So why does it still take the lives of 54,000 South Africans per year? Part of the reason is stigma. As healthcare workers, we can help to prevent this. We can reduce stigma so that patients can get care early and get the support that they need throughout their TB journey. Let's learn how. Stigma is a set of negative beliefs, often untrue, about something such as a disease. Stigma can impact whether people are tested for or even cured of TB, and it shows up in many different ways. Internalized stigma is what a person feels about themselves. This can be shame, guilt, or self-blame.
I was ashamed. I didn't want anyone to know that I have TB. I thought I did something bad.
Shame can lead to silence, feeling alone, and not telling people around them who can support them. Another kind of stigma is anticipated stigma. This occurs when we fear we will be judged or discriminated against. This expectation of stigma affects how we act.
I'm scared to go to the clinic. They might judge me.
The last kind of stigma is enacted stigma. Enacted stigma is direct discrimination or poor treatment from someone else.
They make you feel like you're nothing, like you're a dirty person. They don't want to talk to you.
So what does stigma look like in the clinic? Stigma can start as soon as one enters a clinic. For example, if people with TB are given a folder of a specific color or that has a sticker on it that marks it as different. Or if signage reveals that they have TB. The way a healthcare worker treats a client with TB is very important. Stigma can be shown subtly by avoiding touch or by rushing through a consultation without listening or explaining. So, how can we address stigma in our clinic? Let's review each situation and suggest some actions or phrases that could help. Treat all the clients in the clinic with the same respect. Client folders should look the same as all other folders, with no distinguishing marks or colors. Neutral signage can help protect the client's confidentiality. Putting on a mask while consulting with a person with TB is important in early treatment, but people may find it stigmatizing. Explain why you have to put on the mask.
I have put a mask on because TB spreads through the air. We use masks when we speak to all of our new TB patients because for the first 2 weeks of treatment, you are still able to spread TB. And this is a standard policy that we use for everyone.
A friendly, respectful attitude will help a client open up to you about potential problems in their treatment. It is important to listen to them. There are certain things that you can say to reassure clients about their TB diagnosis.
Anyone can get TB. If you breathe, you can get TB. You haven't done anything wrong if you get TB. You are still the same person. Having TB has got nothing to do with being clean or dirty, being poor or being rich. If you breathe, you can get TB. We can cure TB and you can get well again.
Some words that are commonly used in a health facility are stigmatizing. There are other words that will make people feel more supported. For example, instead of using the term TB suspect, use person with presumed TB. Instead of defaulter, use person lost to follow-up. Connecting a client with TB to a trained peer or TB champion, in other words, someone who has survived TB, can also be a valuable support. The way we as healthcare workers respond to clients can influence whether they get tested and be cured of TB.
The nurse treated me like a normal patient. She was kind and explained what was happening. That really gave me strength.
It helped when they gave me counseling. They told me TB is curable. I'm not the only one.
When they listened and didn't judge, I felt I could finish my treatment. That's what made the difference.
TB is curable. Every person with TB deserves respect and compassion. As health workers, our words, our tone, and our actions have a huge impact on the patient's TB journey. Counseling is key to reduce stigma and ensure understanding. People with TB need support, not stigma.